Okay, I hope everybody can hear me well. All right. I record this because I am learning how to speak, so I will review this later for feedback. Any feedback is appreciated. There's a lot of slides, so it's almost like a bird's eye view on the state of physician wellness and some of the interventions. This is not something that could be addressed in just 45 minutes. I could probably also talk for like 2 days about this and still not be done. So forgive me for trying to compress some of the things. Happy to expand over them. I wanted to title this presentation of Being a Rebel of Your Own Story and How to Tend to Your Own Garden. I recognize that some of these topics may not be as relevant to some of you because you are semi-retiring or retiring, but I hope it will maybe invite you for some reflection on some of the things you have done in the busiest times of your practice. And even if something may not be acutely relevant to you right now, I'm sure in your ripple effect of the people you know, the children, your colleagues, you can still spread the message and spread the word of changing the culture of medicine. I wanted to begin this presentation with this quote. Recently came up in my social media feed, and I thought it was so timely. So Adam Grant is a famous public speaker. He wrote a bunch of books on organizational psychology. One of them is called Hidden Potential. And it says, in toxic cultures, burnout is a badge of honor. Working through exhaustion is celebrated. In hustle cultures, burnout is a sign of weakness. Hiding exhaustion is rewarded. In healthy cultures, burnout is a call for help. Exhaustion highlights a workload problem to be solved. I'll leave it with this for now, and I'll just let you reflect on where do you think your work culture lies, where will it fit, or where maybe you would want it to fit. As we are a CME program, the objectives are define physician burnout and review most recent data from the CMA Physician Health Survey, so Canadian Medical Association. Describe potential causes of physician burnout, including personal traits, culture, systemic contributors, and offer an overview of self-care practices and tools on improving physician well-being. So many of you could probably imagine how this all started. When you were students dreaming to become a doctor, you were imagining that if you just work hard enough, you jump through all the hoops, get through all the exams, you sacrifice now so that, one day, once you get to medical school, or once you get to the residency of your choice, or once you become a staff, you finally will be happy. And at some point, when you were kind of like at this stage, you probably thought that once you become a doctor, your life will be something like this. Like, this is how the life will be once I finally do this all and accomplish all this, and all this hard work will pay off. But guess what? Most of us face life kind of somewhere like this, where there's multiple demands on never-ending to-do list of a physician with pressures from all sides coming at us, right? Like patient demands, administrative demands, government demands, and so on. So WHO came up with sort of an official definition of burnout with the main 3 symptoms of burnout. There's no, currently there is a lot of different definitions of burnout. The main thing is that it is not considered a DSM diagnosis. It is an occupational phenomenon, which basically is characterized by a feeling of energy depletion and exhaustion, increased distance from one's job or feeling somewhat cynical, depersonalized about it, and then reduced professional efficacy or reduced productivity. So Canadian Medical Association, interestingly, did a physician health survey in 2021, and these are the results from 2021. They did launch a physician health survey this year, 2025, again in March, finished in April, so the results are not published yet. So this is supposed to reflect the results post sort of acute COVID, so 2021. And they used Maslach burnout inventory, which is the only kind of widely accepted inventory tool. For some reason, it only has 2 out of 3 questionnaires. So only 2 symptoms out of 3 symptoms of burnout. But you could see that generally, you could get the sense that all the respondents, the practicing physicians, and the residents all responded that they have at least one of the indicators of burnout pretty high, like above 50% for all of them. High level of emotional exhaustion and depersonalization. They didn't ask the productivity question. So why do we burn out? Or why do healthcare workers, not only physicians, I wonder if you ever thought or kind of had an idea of what could be contributing to that. Let's do popcorn if anybody has any thoughts. What makes us prone to burnout?
Long hours, long working hours.
Yeah.
Never say no.
Exactly. Yeah.
Patient load too high.
Yeah, high job demands. And,
The nature of the job, you almost have to be perfect because you're dealing with people's lives.
exactly.
So striving to be the best with every patient.
Yes, yes, all of those things. There are different categories of why the physicians specifically, are so high on burnout. So personality traits. We are selected in the medical interview, the way we're getting into medical training, type A personalities, tendencies to perfectionism, high achievement, like high achievers, people pleasers at all cost, can't say no to another extra patient. We don't want to upset our patients that we're committed to, or administrators if the secretary asks us to squeeze in somebody else. And then the ability to successfully self-neglect and sacrifice, right? Remember your residency training, how many hours you could go without sleep or food or even bathroom breaks. So it's almost like the system is weeding through, and those who can get through this, those become physicians. But even not only that, the culture of medicine itself, there's a PubMed reference there if you want to look into the particular study that I looked at. It's very interesting about the attitudes of physicians. But basically, there is an expectation that physicians will provide high quality, almost error-free, or expected to be error-free at all times, regardless of the circumstances or the system limitations. It is part of our culture to be putting up with the broken system, the toxic work environment, the burdens of the inefficient electronic medical record systems, or whatever is the next hurdle that we have to deal with, depending on where we are at, even politically. We just put up with it. And the expectation of the invincible physician. So the dehumanization of professional values. So the expectation that despite everybody, we do teach our patients that you need to sleep, you need the nutrition, you need to look after yourself. Somehow there is a perpetuating culture that we're somehow very immune to sleep deprivation and getting cardiovascular disease from not so nutritious diet and so on. And disclosure of struggle is highly discouraged. It is, in many studies, they actually talk how, physicians who point out that we are not invincible often will be stigmatized as somebody who's weak. So we're not yet in a stage of open culture where we can talk about how certain things and demands that we face are not appropriate and not fair. And another big part of medicine is isolation. So dentists, physicians, and lawyers are the most lonely professions in the world. That is correlated with a very high suicide rate. But why in medicine we're so isolated? Well, part of it is that our working hours are very non-sociable. We work weekends, nights, even if we're done 9 to 5 office job, oftentimes there's a lot of follow-up, there's a lot of inbox work that we have to still commit to in the evenings. And then it is difficult to build new friendships and build new connections once we are sort of it's lonely up there on the top, right? Like once you climb all the ladder to get through all the training and everything it takes to become a physician, your childhood friends, for most people, their childhood friends, their undergrad friends moved on with their lives and they are not in sync with you anymore. So they maybe already have children, different careers, and they just don't resonate. And it's very difficult to build new friendships once you are adult and you're perfectionistic and people pleaser and all of those traits that we have. And a lot of people get intimidated by us if they're not in a medical field or not physicians themselves. Why it matters? Of course, on the bigger scale, yes, the high rate of physician suicide, the high rate of exiting profession. We probably have seen this a lot during COVID when a lot of people who were close to retirement chose to retire early. But behind the scenes, I think what is more applicable to all of us is that a lot of physicians, or I dare to say most of us, are suffering in silence, losing the quality life years. And what that brought, the thoughts that it brought to me was that over all those years that we learned how to care for people, they taught us how to help others, but they never really taught us how to tend to our own gardens. So what if I tell you if there is the way out? Would you believe me? Not another wellness pitch. So, and this picture actually represents the attitudes of physicians in the recent surveys and studies towards resilience talks and wellness interventions at workplaces, because of all of the culture of medicine attitudes I mentioned above, because there has been this perception that the leadership, the admin people, they just want us to be more resilient so that they could put on more work on us, so that we could do more, so that they could squeeze out more out of the same capacity person. I just wanted to put it out there that this is not the purpose of this talk, but I recognize that this could be the first gut reaction that people could have. But before we go into those interventions, I wanted to bring up this very interesting article by Dr. Scheinefeld in Mayo Clinic. I follow his work since medical school. Physician wellness has been always an area of my interest, and I've done some work with Mamta Gautam, a psychiatrist in Ottawa who is quite famous for her physician wellness work, and she was a physician coach even before that became a thing. I think she's done a lot of physician wellness work since the 80s, and we've done some research and some presentations together. And Dr. Scheinefeld's articles always will pop up when you start searching PubMed on physician wellness or burnout. So a very interesting idea about the eras of physician well-being, and I'll show you why. So the basic idea is that, and some of you probably have faced the sum of parts of different eras. The era of distress in physician well-being is basically before 2005. And this era is characterized by perceiving physician as somebody who has detail-like qualities, expected perfection in work. There's no limits to work. There's no really work-life balance or work-life integration. And there's a lot of isolation in the physician work. And everything is about performance. The social outlook for profession at that time, and this is not made up by me, this was in the article, is that physicians in that area of well-being were mostly main income earners for the family. So the spouse would often be, either will have not as high demanding profession, or will have no career at all. So that one person is completely devoted to medicine, and the partner is completely devoted to running the life for this person. The next era of well-being 1.0 is where we're at now, and they stipulate that it began between 2005 to 2010. So before this era, there was no recognition even of the occupational stress and burnout. There was no articles about this, no works really internationally on burnout and preserving physicians' health. So in the 2000s, in the early 2010s, we start seeing more works rising the attention to the occupational distress and then the implications of physician burnout on patient satisfaction, quality of care, and it becomes somewhat an interest for administrators as well because they're starting to look at physician wellness as a return on investment. And there's still, however, expectations from a physician to have hero-like qualities, patient care above everything. There is beginning of the information on wellness talks, resilience talks. We start talking about work-life balance. We start talking about building resilience so that we can do more. But there's still a lot of frustration between the stakeholders and the physicians, and not so much uptake from the either side on the physician work-life integration. Meanwhile, the social part of the profession is changing. A lot of there's a higher proportion of female physicians in the workforce, and because of the economical changes in the world, now it becomes less possible for one partner to work. So most physicians will have a dual income or shared responsibilities, families where it becomes very difficult for one to be completely devoted to their job and neglect their marriage, neglect their children. More physicians are trying to balance being a parent, looking after their household, maintaining relationships, and still be good at their job. And unfortunately for many, it became almost like a question of, do I scale down to part-time? Do I scale down to having less income in order to still keep up with everything I want from life? It's becoming a hard choice. And where we're heading, and in some centers it is already in the early stages of well-being 2.0. Some centers in US, I think, are already in their early stages, is recognizing that physicians are human, the recognition of the humanity of all of us, and building that culture of vulnerability and growth mindset where people are not penalized for speaking up when things are, when the expectations are way too high of the work demands or the hours. The self-compassion becomes a big part of building that culture of community, but also not stigmatizing physicians who are being open about our humanness. And we're shifting from the frustration to a work of meaning and purpose. This is sort of the same thing. It's a very interesting article. Really encourage you to review it. And I want to come back to this slide and remind you and just see where you think it fits, because even though this is not about medicine, I think it reflects very closely to the different eras of physician well-being. So who here had a burnout in their career? Well, I've done it many times. Not a badge of honor, but definitely has been through many cycles, especially with transitioning. And studies show this, that oftentimes medical students will experience burnout when they're transitioning from pre-clerkship to clerkship, and then from clerk to resident, and then from a resident to early career to staff. And then any transition in practice often would be associated with burnout. And it is, I think, very normal to go through these cycles, because even though you can adjust and do some burnout prevention, some of the things are not in our control. COVID, for example, was not something that you could have planned for and prepared for. So it will always be sort of an ebb and flow where we will need to just learn new strategies or lean into new things to get through them. And because I'm so experienced, of course, I found a bullet point. A bulletproof, no, I'm just kidding. There's no bulletproof way to prevent burnout, unfortunately. However, I did divert in my career at some point into doing GP psychotherapy, and I trained in CBT. And in the beginning of my training, I learned something very important, which I think is very helpful and could be applied to us as physicians as well, is before you start doing therapy and doing all the exercise or whatever modality of psychotherapy you are doing, it is important to empower our patients to do the self-care practices, because if somebody is completely sleep deprived, for example, no matter how much medicine you're going to throw into them or how much therapy you do, it's just not going to work. Or if they have sleep apnea that's untreated, could be mistaken for depression. So I know this is all kind of obvious, but at the same time, even though we know what we're telling our patients, what we're supposed to do, oftentimes we either think that we're immune to this, or because our to-do list is so long, this often gets to the bottom of our to-do as the least priority. So I invite you to put this higher on your priority list and capitalize on sleep, exercise. I bundled a lot of things into self-regulation practices, and I'll talk about this, and then nutrition and connection with self and others. And the more I read about longevity, disease prevention, it often will fall into those 5 pillars of well-being. So I find it very helpful and useful, not only with my patients in my hospitalist practice or in my previous GP psychotherapy practice, it's also very important to apply to us and review this from time to time. And I know this could be, all of them could be, each of these topics could be an hour or several hours of talk. So we're going to do just a brief bird's eye view with some of the tips, because I know you're a highly educated, intelligent audience. And I hope we can get through some of those things. So some of the things on sleep. The growing body of research right now shows that there is a lot of health risks associated with lack of sleep. So a lot of immune cells activities are going down, so we're less resistant to cancers. Underslept students are more prone to getting viral URTIs. There's so, like, if you just look at this, if you just read this book, it is a very good sleeping aid. I tried to read it, I tried to listen to it. It always puts me to sleep. It is very boring. It has a lot of research, however, on sleep studies, various sleep tortures they have done to people to prove how bad is it if you don't sleep. So highly recommend. But basically, what it comes down to, that most people need somewhere on a spectrum between 7 and 9 hours. I find that tracking your sleep is very helpful if you're somebody who thinks, oh, I can just leave on 5 or 6 hours of sleep. But if you actually do almost like a biofeedback on how much you actually sleep based on whatever wearable you have, and you correlate with your symptoms, if you do bother to journal or something like that, you will see that the more you sleep, the better person you are, or maybe your family will appreciate that, or your patients. And what I find as somebody who works very odd hours and weekends and so on, winding down rituals became something I really depend on. So things to down-regulate yourself, things to reduce that sympathetic nervous system activation a few hours before you go to bed could be really a game changer. Exercise. So a recent very popular book, Outlive by Peter Attia, made it very, very popular to talk about importance of exercise. I would make a claim that this book, Spark by another psychiatrist from US, actually has a lot of data and evidence on exercise and mental health. any system in the body you go through, you can make a very reasonable claim that exercise will make whatever condition better. The bigger question is how? How do you get to exercise when you already have so much on your plate? So some of the things that I found helpful for myself or my patients or my colleagues is doing exercise snacks. So if I'm charting for several hours in a day, and there's nobody else charting with me in a room, when my watch tells me that I need to move, I'll just stand up and I'll do 10 squats. And that usually this buzzes me like every 30 minutes. So wearable devices or timers to remind yourself to do some movement and go for a walk somewhere to a different area, grab some water can be helpful. It's better than nothing. I want to say that, the 10 minutes of exercise you do, maybe even yoga, is better than 1 hour of heavy lifting that you never do. So just think about it. You can discount a lot of types of movements and kind of think, oh, but that's not, because we're all or nothing, right? We're perfectionistic, we're type A. Oftentimes, I went into that mind trap of thinking, yoga is probably not enough, not gonna bother. So some of the tips would be habit stack it. If you're working on relationships with your children or your spouse and you wanna go for some deep talks, just habit stack that and do like an evening after dinner walk. Apparently that is very good for your insulin resistance or for sugar metabolism. If we go on a walk immediately after a meal, so after dinner, let's say 30 minutes, that might be a way to put in those steps. And tracking it, interestingly, there's a lot of studies that show that if you just log whatever habit you're trying to build, so if you're trying to build the habit of exercising, if you log it in some way or form, that will increase your motivation and will increase your adherence. So I have a separate journal for where I put the exercise, and even though it's the littlest thing, I did something for 10 minutes. After 2 weeks, I see those lines and I think, not bad. I've done something, this is good. And it keeps me going. And I think I'm pretty similar to most of my patients. My GP psychotherapy practice was focused practice on high-achieving anxious women. that was my area of expertise. Okay, and self-regulation practices. This is probably the most near and dear topic to my heart that I would love to talk more about. Thank you so much for talking about meditation. Some of the things that could be helpful, lots of meditation apps, MBSR course, something you can use as a CME, mindful self-compassion course, lots of them are offered now in community centers and local institutions as well. Various visualization practices could be helpful as well to down-regulate the anxiety. And a lot of Buddhist practices as well kind of capitalize on imagining how small our problems are in the context of how huge the universe is. And when you actually go through the steps of visualizing yourself, looking at your town, the planet, and all of that, and how small that is, it sometimes does help to reduce that catastrophizing mind that sometimes overwhelms us. Different breathing techniques such as pranayama breathing, yoga, and the whole point of it is basically getting out of our thinking mind that's often racing to our body. And the book I'm mentioning here is Kristen Neff. She's done a lot of work in the field of self-compassion with Chris Germer. She has a lot of courses online and webinars and various events that you could attend, but this was a very, very helpful book, or I would recommend it to anybody who has any interest in self-compassion. In many new psychotherapy modalities, such as, for example, internal family systems, that imagines us being kind of like in an Inside Out movie or cartoon, that we have these different personas in our mind, and some of them could be acting out and could be kind of moody. There's this notion that there's no bad parts. Even the parts that sabotage us, all of them aim to help us and to bring safety and to sort of safeguard us. And the real cure is to pour love and compassion on that part so that part feels safe enough. And I think this is going to be the future of physician well-being as well, is learning to be compassionate to self, because once you're more compassionate to self, then you could be even more kinder to others, and there is less judgment. Self-compassion is very, very intertwined and is based on mindfulness practices. But I won't delve more in that, and we'll jump to next topic. Nutrition is a highly debated topic in terms of which diet is the best. Currently, we learn about Mediterranean diet, but if I were to, what I would usually say to my patients is, try to do a rainbow plate. The more colors, the better. There's a growing field of integrated psychiatry, and a few psychiatrists in US wrote fascinating books on using food for mood disorders, or for food as treatment, which is of course is a blooming field, but the basic information is increasing the fiber to 30 grams a day, increasing your protein intake to 30 grams per meal, or there's various equations that different specialties will use. Again, tracking or trying to journal of what foods make you feel good. So there are things that we love eating, but sometimes they don't love us back. So just noticing what is working for us, and then abandoning the labeling of foods as good or bad, and referring to them more so as nutritious foods and fun foods, and kind of following more of an 80-20 rule. 80% of our meals being the nutritious, everything kind of colorful, good healthy fats, and then 20% allowing ourselves guilt-free to have the fun foods we want. I think were my main takeaways from a few of the conferences and the books that I came across, or what I work on with people. I threw this optional bonus slide about self-understanding, and I think it's very important for us as physicians to develop practices of going through things or processing things that we see. Journaling, narrative medicine workshops, or generally anything narrative type of practices have shown a lot of promise. Also gratitude practices, lots of studies show very positive effect on mood. Therapy, mostly to develop that secure relationship with a mature adult, because a lot of the times we have to be the adults and we have to be the mature ones for our patients, but who is there for us to be that mature adult? And there is a lot of psychotherapeutic or psych CMEs that you could use, especially in general practice, that will be very beneficial not only for your patients, but also for self. Any type of psychotherapy work or training, I find, is always greatly contributing to personal growth. And I mentioned bibliotherapy. I would love to put a lot of books here, but I don't want to take up your time. Bringing up the point of connections and relationships. This is Estelle Perel. She's a very famous couples therapist with a very interesting life story, which we won't have time to go over, but she talks about how quality of your relationships will determine the quality of your life. And this is probably one of the most important things that we often forget. We act on the urgency of our clinical demands, of work demands, everything out there, and we often forget that the people who are most important in our life may not always be there, and the work will always be there. So just remember that. I think she talks about this in the context of the Harvard study. It's very famous and also kind of proves the point. There's debate about how it was done and everything, but it kind of shows the point of the importance of the family, the connection, the community in your life, and how it impacts your longevity and your health. The final proactive tip on connecting with others, which is a huge part of longevity, a huge part of physician well-being, and a huge part of the physician wellness 2.0 is building those communities, building relationships with others in medicine, but also outside of medicine. And oftentimes we feel like there's not enough time for us to do things. So some of the great advice I've collected from other talks or resources is don't be afraid to be rubbish, so to say. So just going out of your comfort zone and doing things that maybe you're not great at. So you're already a great doctor. You could be a bad hockey player or a bad singer, but that will put you outside of your comfort zone and you will meet new people. So joining choirs, yoga studios, dance groups, stand-up or improv groups, Toastmasters. I've started Canadian Women Physicians Toastmasters Club before CME dinners. So in my area in Halton, 25 years ago, there was a change in the hospital system and there was increased isolation among women physicians. And you probably know Jane Charters.
She just
I
retired.
just haven't known, but she's still running this effort.
Yes. So I wanted to talk about this.
Maybe I saw you there, you saw me, we didn't know each other.
Perhaps, yes. So one of the physicians in her group had a newborn baby and she really struggled with everything that we go through in medicine, but particularly 25 years ago, being a woman in medicine with a baby was even more difficult. So she jumped off in front of the train with her newborn baby. And Jane kind of reflected on that and recognized how isolated we were or we are in medicine. And she started this dinner group where she will gather the women physicians, the local women physicians from Oakville once a month for like a journal club discussion. And her group grew so much that the overflow from Milton and Georgetown, she couldn't accommodate anymore. So a few years ago, I started the one for Milton and Brampton and Georgetown, and we have a very, very lovely group. And this really feeds my soul so much because this is where you meet other people. So even if you don't have a group like this to join, you can always start one. And I could speak that really boosted my wellness a lot, even though it takes some time. And same thing, hosting events for others. Okay, so I just ran through a gazillion of things, and it's not meant to be something that is recommended to implement right away all of them at the same time. This is simply not possible and very overwhelming. This is just a buffet of things and interventions that you can pick and choose from and see what speaks to you the most and try it on and see if it fits. If it fits, you keep it. If it doesn't, you let it go, you try another thing. That's my take on any sort of wellness tips, because it's always easier to say, yeah, just do these 5 things, sleep, exercise. But there's, of course, much more to it. I hope you like to read. We don't have time to go over so many books that I wish I could tell you about, but I did want to give you the main ideas of a few more books about productivity, because it is all about practicing medicine. So Ali Abdal is actually a UK doctor who is an entrepreneur and YouTuber, and he quit medicine because now he's a millionaire. But his mother is a psychiatrist, and when he was doing his residency, he was burned out, and she taught him on 3 types of burnout, not addressed in WHO and not addressed in this talk. Highly encourage you to read the chapter on burnout because it speaks about your values and some of the things that are really interesting in terms of alignment of your life vision. A little bit of an opposite take on hustle culture is this Toxic Productivity book written by a therapist. And I think it is a really great work summarizing all of the things we need to do on our boundaries, which I think a lot of the physicians are struggling with, is protecting your boundaries like your life depends on it. Because people or systems will often try to invade on it. And to close, another plug on Oliver Bookerman works. This book, 4,000 Weeks, talks about how limited and finite our life is. So even though a lot of things seem to be very urgent and important for us, if you think that most people will only have about 4,000 weeks and every day that time is running out, I think that might help us view our time as something that needs to be used very wisely. So kind of applying that choose wisely campaign in your ordering practice to your life. And his most recent book, Meditations for Mortals, has a lot of great philosophical messages. And one of them that really spoke to me was that you will never be really done figuring out your life. You will never fully sort out your life. So if you're waiting to be happy once you finish this or that, once you retire, or once you sort out all of your charts and billing and all of that, and after that you can be relaxed, then it will just never happen. Because by the time you finish sorting something out, life will throw another thing at you. And it's a really small book, but it is very profound, with good chapters on people pleasing and a lot of things that I think is almost as if it was written for us physicians. But maybe it just speaks to our humanity, that just like everybody else. If I had time, I would take you through the personal self-care card exercise. Perhaps something could be done on your own time, but a really fun thing to do. I've done this in 2020 in the middle of COVID with our teacher on the CBT, Dr. Greg DeBoard, and it still stands in front of my work desk, where I promise myself to do more, things I love, things like gardening or yoga, and to do less of overcommitting or whatever it is for you. So in conclusion, I encourage you to always go back to basics, kind of like ABCD of emergency management. When you're feeling that you're getting burnt out, go back to sleep, exercise, nutrition, self-care, self-understanding, connections. Be a rebel of the culture of medicine. Regardless of the stage of your career, spreading the message and the culture of compassion to our human limitations and building that community, even changing the culture at our workplaces when we work in teams and we sometimes expect or judge others for not being able to work as hard as somebody else. You don't know what challenges they might be facing in their life. We all carry the responsibility for our own happiness, and studies show that at least 40% of it is our own, is modifiable by our life, and I think only 20% is genetics. This was in a recent Sam Harris episode with one of the psychiatrists, so you could look it up. And I invite you all to be part of the movement towards the shift of Physician Wellness 2.0 era, mainly in the mindset shift. And again, going back to that notion that you will never fully figure everything in your life, and we sometimes have too many unrealistic expectations of what we want in our life. Sometimes we just need to let go of certain things. So for example, I would love to learn 5 more languages, but if I really want to be happy in my life, perhaps that's something I can let go and just enjoy what I have right now in the moment. And thank you all for attention and your patience.